Okay, I think we're ready to start the next session. I hope everybody can see and hear me. I'm Nick Robinson, presenter of Radio 4's Today programme, formerly political editor of the BBC and ITV News. I was delighted to be asked to do this because having relied so much on scientists to explain to our listeners day in, day out, what on earth was going on and what they thought might go on in the future, it seemed to me the least I could do is try to pay back a little bit by having this session. But I was interested for another reason as well, or rather two important reasons. One, I think in my business, political journalism, we do too little about the interface between policy and politics. Politics is far too often restricted to the greasy pole, who's up, who's down of politics, rather than understanding the complexity about balancing public opinion, internal politics in parties and parliament with policy decisions, particularly policy decisions shaped by science. The second was a rather personal reason. You may be distracted, I hope not too much, by photographs from Vietnam behind me. I went to Vietnam as this pandemic began, having asked 4 separate consultants whether it was safe for me to do so, because I'd had lung surgery and still had an ongoing lung condition. Indeed, I was on the government shielding list. And therefore, I took a rather personal and passionate interest in quite what we knew about COVID and what we didn't. But let me introduce one by one, rather than doing them all at once, the people who are going to give you much more information than I can possibly do. They'll each speak just for a couple of minutes, and then I hope to get a lively conversation going between them, because we're incredibly lucky to have the group of people we've got. I mean, just to give you the headlines of who they are: Professor Dame Angela McLean, Dr. Anders Tegnell of Sweden, and Professor Glenda Gray of South Africa. I'll give a slightly longer introduction as I ask them to speak to us. But let's first begin with Professor Dame Angela McLean, Chief Scientific Advisor at the Ministry of Defence, Professor of Mathematical Biology at Oxford University, who will give us the first of our 3 overviews. Over to you.
Thanks very much for that introduction, Nick. I'll just very briefly explain how I ended up being a civil servant at this particular moment, because it's perhaps a slightly unusual job I have. So I'm what's called a Chief Scientific Advisor, and in the UK government, those people tend to be external academics who come and work as civil servants for a few years. So I am a civil servant at the moment, and I have been for the last 2 years. I won't be for very much longer. So they're on purpose, they're temporary posts, so that you do have some outsiders working inside government. I was sent rather a useful list of questions, much too long to talk about for 5 minutes, so I thought I'd try just a few, actually. So one of those questions was, did you feel constrained by your roles in what you could say within and outside government? So actually, yes, I am completely constrained because I'm a civil servant in what I can say outside government. But inside government, I felt very much not so, actually. And I think one of the good things about the kind of job I have inside government is that I'm not trying to build a career as a civil servant. My time here is completely limited. And so it really frees me up to ask questions that might be awkward. I think that was all I wanted to say on that. So I've never felt constrained inside governments. I suppose that does slightly depend on whether I'm having a policy discussion, i.e. talking with other civil servants, or sat in on a politics discussion, i.e. When there's a bunch of ministers there, because I think when you're in a room with a bunch of ministers, the word servant does weigh quite heavily on you. But in all the policy discussions, no, there weren't constraints on what I could say. And then the second question I wanted to turn to was this one about some of the science has been very heavily politicised during these last 20 months. And how can the science community, government scientists in particular, best deal with this challenge? Now, some of that I thought was, I listened into most of the previous session, I thought was dealt with very well there, but I don't think I think some of that bears saying again. So it seems to me that one of the reasons SAGE was set up, one of the reasons we have this scientific advisory group for emergencies in the UK, is so that government can have a trusted voice who will say, well, from one set of respected scientists, this is the consensus view. So I think where there is consensus, it's extremely useful to have that presented in a way that is clear, and I think we're all agreed that having that very open as soon as practical was a good step forward. Secondly, of course, is to talk about where there isn't consensus. It seems to be one of the things that experts can really help with is say, here's a place where there isn't consensus, and this is why there is no consensus. And one of the things that is really helpful to say is, here's the following, if we could resolve the following uncertainty, then we might be much nearer to developing a consensus on that question. And then thirdly, this was something that Christian Joston in the last session was saying, and I think quite correctly, none of us should present personal opinions as though they are facts. It's just really unhelpful. So that was my lot for the second one. And then finally, I was going to talk about something I'm really interested in, actually, which is how has the pandemic affected how data and analytics might play a role in forming policy outside the pandemic in the future. So I think there was already quite a big conversation happening inside government about how we could be more scientific. There was a conversation about, well, you know, what can we do to put science at the heart of HMG decision making? And for me, at least, one of the way I would state that would be that in the future, I'd like to see a future where Her Majesty's government routinely uses scientific evidence, properly tensioned with economic evidence, in all of its decision making. I mean, why wouldn't you? And I think some of what's happened in the last 20 months has been a way of playing that out and actually learning as we go which bits are more difficult and which bits are easier. And I'd like in that, and I'm just going to briefly finish by adding a few things to that. I think it'd be great if right across government we had a much clearer understanding of the different kinds and qualities of evidence that can be brought to a decision. I'd love to live in a world where to make a statement without sensible underpinning evidence is viewed as profoundly embarrassing. And I'd also like it to be very clear that it is not an embarrassment to change advice when the underlying evidence changes, because that is a hallmark of evidence-based advice. And just to refer back to the previous session, those points were made very clearly by Nicola Alexander and Angela Ahuja. And I think those would be useful things to use going ahead. Thank you.
Thank you very much indeed, Angela. I'm very grateful for that. Don't feel, Professor Gray and also Dr. Tegnell, do not feel that you need to get through everything, because I've got an agenda and we'll do it in discussion. So let me just turn though now to Dr. Anders Tegnell. Many of you will know you as, in a way, Dr. Fauci was possibly the globe's most famous scientist in this crisis. I suspect, at least in the UK, you were the second best known, Dr. Tegnell. State epidemiologist in Sweden, for those who don't know the official job title, Deputy Director General of the Public Health Agency, and a man with a PhD in infectious diseases. I'd like you to just address that briefly, if you would, from the very different perspective that you would have coming from the experience of Sweden.
Yeah, thank you. Thanks for the invitation. It's a very nice and I think very important meeting. No, I was not going to answer the questions right now. I think we're going to come back to them. I was just trying to put it a little bit to give you the Swedish context briefly as a background to why things are different in different countries. And I think that's the fascinating part of this, that we are much more different than we think many times. Sweden, when it comes to public health, communicable disease control and so on, is a very federal country. We have 20 regions who have the complete mandate to take all decisions on their own. They should be evidence-based. It's set down in law that they should be evidence-based, which is nice. But since evidence not always are that clear, it means that they can take rather different routes in a pandemic like we are right now. So that's one thing that we need to remember. Our role at the national level is to coordinate. We can take some decisions, but that forces the regions to do things, but they are quite limited actually. So that's one thing important to know. The other thing is the relation between the government and the agencies in Sweden. The government in Sweden is small compared to most other countries. It's completely, I would say, working with political issues. policy issues are delegated to the agencies. And even the agencies can also actually regulate things, have certain powers, law powers to regulate things. So the division of labor between the government and the agencies are different than in most other countries. And that, when we comes to the science part of this, it means that the agencies are actually the ones interacting with the agency, with science and academia. The government does that very, very limited and officially not at all, I would say. So it's the agency's role to translate science into policy and have that discussion with the government, how we should use new science in different ways. And that means that the agencies are very much dominated by academia. I mean, 50–60% of our personnel have a PhD in the agency. And we have a lot of interaction with academia in different ways. We even do a fair amount of research ourselves. But that means that there is no political advisors, there is no scientific advisors in the government. When there is scientific groups, they are formed by the agencies who form these groups and have interaction with them. So that means that the interface between the government, the political government, and science is quite different in Sweden than in many other places. And some people will say it's a good thing. It gives more stability to that, and also to a certain extent, I think, protects politicians from having input from many different sides. And probably, I think this is something that's also appreciated by most politicians in Sweden, that they have this interface, because it gives them a kind of safety net to have somebody else who actually sort of filters and makes some kind of judgment on the science that's coming out. And that, I think, gives quite a lot of background and gives a lot of reasons to why Sweden looks a lot different than the rest of Europe in many ways.
Let me just, if I may, Dr. Tegnell, pursue one point, because I think it'd be useful for people listening and watching. Most will be very familiar with Angela being part of SAGE, and SAGE, as it were, feeding its advice through a chief medical advisor on the one hand, chief scientific advisor. You deal directly with your political masters, do you? You do not have to get your, as it were, recommendations first approved by scientific consensus or a committee.
No, that's correct. We are having these committees, we deal with them and find consensus that we can then deliver to the government, and we give them the advice to the government, of course, based on different expert groups we have.
Well, thank you very much for the moment. Let me bring in Professor Glenda Gray now, who's President and CEO of the South African Medical Research Council. She chairs the research committee on COVID-19 as well. And if you could tell us the story you want to as Professor Gray, but possibly as you do so, just reflect on how SAGE-like you are, in the other words, a committee directly reporting to politicians, or how much like the Swedish model, with that being rather less politicised.
I think we're a hybrid. So we do have a ministerial advisory committee, and as the president of the MRC, I'm like Francis Collins, and so I give advice directly through to the minister and also indirectly through the ministerial advisory committee. So I'm just going to, seems like my slides are okay. So South Africa was very much the balance between the public health and the socio-economic impact we had from the kind of actions we took. And so we saw this whole debate in the public domain, what was more important, lives or livelihoods. And so we went into a very early and hard lockdown. I think we had one of the harshest lockdowns in the country. We had a national state of disaster, and there were lots of things that happened. And I think what was critical was the prohibition of tobacco, the banning of alcohol, the formation of the National Command Council that brought into the sphere was the Security Council, the police, and it was never ever clear who was in charge of the National Command Council, and all information was deferred there. Terrible things that did happen was our early childhood development centres were closed, and the school feeding schemes were suspended, which allowed a lot of children to go hungry. But there was also other stuff, bringing in the defence, the authority to issue direction, and the issue around fake news that was very much tenet of the national disaster. And what led to a lot of corruption was the emergency procurement policy that allowed rapid use of government funds for things that landed up being fueling corruption in our country. So we had lots of pros and cons, but I think what we use the lockdown strategy now on as a strategy to contain waves or surges. But initially it was very important because it brought in initial social cohesion and public buy-in. And we were one of the first people to implement masks in public, which we still have. One of the terrible things is that we had 3 million job losses, mostly to women. We had tender corruptions. We had lost 40% of our school year, which impacted our poorest households. We exacerbated hunger by having no feeding schemes. We saw mental health issues and gender-based violence ballooning, and we also saw a huge impact on our chronic diseases like HIV, TB. Our workplace culture is now under threat. We saw a lot of centralization of communication, and our National Command Council centralized all the data and information. So very much Disaster Management Act. We have a couple of ministerial advisory committees, but this changed a lot. Particularly after the MAC advisors became very vocal in public. Some people were let off, myself included, and we saw a lot of combination of how, although the government was emphasising an evidence or science-based approach to manage the pandemic, there are lots of competing stakeholders, and so the government was juggling a lot of agendas and had differential uptake of advice. For instance, our taxi industry, I'm not sure if you know South Africa, but we transport a lot of people in minibus taxis, and the scientific advice was to keep the taxis 70% occupied and windows open, and this could never be realized because of the taxi bosses. There also was a huge fight between keeping schools open, and this was in contradiction to the teachers union and WHO guidance. WHO had very strict guidance on when to open up schools, and if we had to follow them, we would never have opened up our schools. So sometimes there's even conflict at a national level. And then more recently, the issue of vaccine mandates, and because we're going through a municipal election, is that none of the political parties would ever put would ever talk about a vaccine mandate because they were scared of losing the popular vote. One of the biggest controversies in South Africa was the issue around excess deaths, which was 3 times more than what we saw in the reported deaths, which got us, the MRC, into a lot of trouble. We were sent to the Command Council to try and explain these, and they were trying to say that these deaths were mathematical and not real deaths. And these deaths mimicked the surges that we had, and there was a fight about whether these were deaths from COVID or collateral deaths. And you can see it's very important because South Africa has had one of the most devastating epidemics. So if you look at our excess mortality, you can see that, not in the public domain, but how severe our pandemic was, which is a disservice to us, particularly when we're talking about issues about vaccine mandate. Impact of regulations on unnatural deaths was very interesting. Every time we had a surge, we banned alcohol and we implemented a curfew. And you can see that banning alcohol and implementing a curfew definitely kept our hospitals open and kept our hospitals free of trauma. And this created a lot of interesting debate around the use of alcohol control in South Africa. I'm sure you know South Africa has 4 main pandemics, and one of them is violence and intimate partner violence, trauma and violence to each other. So this did impact on our ability to keep the hospitals open for our surges. We also saw in South Africa a lot of corruption and the misuse of public funds, which saw our Minister of Health resign and senior officials in our government being suspended during a time when we obviously needed stable leadership in our government. What we're seeing now, I wanted to just bring this in just briefly, is the issue around misinformation, and particularly around South Africa seems to have proliferated anti-vaxxer and conspiracy theories, and has been one of the reasons why there's a lot of hesitancy in our country around vaccine uptake, and that's why the importance of vaccine mandates. And then also just one of the biggest things in our country as well was this whole ivermectin debate, and that our SAMRC, our regulatory authority, had to issue a compassionate use program, and that we had a lot of misinformation around the use of ivermectin. So I'm going to finish there. I tried to give you a little hint of the kind of stuff that we face at a country level, and that as a public official, I myself worked with the government and also got into trouble with the government. But in the end, everything
just
worked
before
out
you
well.
wind up, Professor Gray, I was fascinated by your phrase that you were let off advisor. Is that a diplomatic phrase for saying you were sacked as a government advisor but continued to be a distinguished public scientist?
Yeah, well, I guess we were let off because there was a lot of debate about malnutrition and the kind of regulations that we had, and if we spoke out, we got I got into a lot of trouble. But I redeemed myself eventually, and my minister and I worked very well together until he had to resign because of corruption.
Yeah, it shows some of the ups and downs of this. Thank you very much, each of you, for this. Now, having started quite general, I want to laser-like become very focused, if I could. The conference, remember, is about data analytics in particular. This session in particular is about the interface between science and politics. Dr. Tegnell, I want to turn to you. When I interviewed Professor Neil Ferguson, who's the man largely behind this event, I remember being shocked when he told me that he'd never had a face-to-face meeting. He'd been in the same room, but he'd never had a face-to-face meeting with a minister, let alone a prime minister. In other words, the man responsible for the models, along with his team, of course, but a man responsible for the crucial epidemiological models that we were debating endlessly in broadcast, never got to meet. Now, an argument for that was that and we'll hear that perhaps from Angela in a second, was that the SAGE process had its value. Do you, though, prefer the idea that you could both do the models and present them direct to policymakers?
Yes, I would say that we do, because as we all have learned during this pandemic, models are not better than the data you put in. And when you start putting in data early on, they have a lot of limitations, and it's very difficult to explain that, I think, to politicians if you're not sort of really sitting together with them. So I think when it comes to these complicated values, I think it's quite important, maybe not to do the models yourself, but at least be involved with them and sort of having a dialogue with the people who actually do them directly. Because I think that's the way I could explain, and my boss would explain really well to the government what are we actually trying to achieve, and also update them on how well our models worked or didn't work.
We'll talk about the different Swedish approach in a second, but just narrowly on this, do you think you might not have been able to pursue what we now know as the Swedish approach if you'd had a SAGE-like model, if you had to, in other words, present merely a consensus view? Because as you know, as we know, there were plenty of scientists in Sweden who disagreed with your approach. I
mean, you find disagreement all over the place, I think. So, I mean, that's always when you start out with a new subject, there's always different opinions on how to do it. It's difficult to know, because we have built this model. It's been a model for 300-400 years in Sweden, and it builds very much on trust between the political government and the agencies, and that trust is very well developed. We know each other also on a fairly personal level. So I think that's also what you need to build into this. It's not just an agency coming there, it's actually a partner that you've been together with through a number of crises and a number of other developments. And that's why you can be quite open with the strength and limitations of what you're trying to sell in, so to speak.
Let me turn to Professor McLean then. Not dealing with all of COVID and SAGE, but specifically this point about modelling and data. Would it be better in the future to say that the people drawing up the models should speak directly to the people taking the policy decisions?
Well, you have to immediately address the question of which models. I'm a huge admirer of Neil's models. I think one does, despite the fact that Neil is our host today, I'm sure he would agree that actually SPIMO, the modelling subgroup of SAGE, always tries to have 3 different models, often has more, as a way of addressing issues about, gosh, we don't want to be talking about things that are model specific. Actually, interestingly, the only set of modelers who actually did get to present their stuff to the Prime Minister directly, and not on SPI-M. And fundamentally, I would say they got there by having very, very strong public relations support. And that is, that is no way to pick what science goes in front of the Prime Minister. So I would say that Sweden has one filtering system, actually, which is that their agencies do the filtering, and we have another. Neither of us has a free-for-all, actually, where whoever shouts loudest gets repeatedly to go and talk to the Prime Minister.
Professor Gray, what are the lessons you learn looking at Britain, looking at Sweden from your experience in South Africa?
Well, I think data is important, and we did have a lot of, and maybe it was the balance between the excess deaths that we had. We were one of the few countries in Africa that could show a devastating pandemic, which was unlike anywhere else could in the world. And we did have a devastating pandemic, which was not public, because everyone would refer to the cases that were COVID positive that had died, and so it was a third less than the deaths, which I think maybe was a good or bad thing, because it created an impression that the pandemic wasn't as bad in South Africa as anywhere else. But it, so I think it was good and bad. It's bad because of our low vaccine coverage, and we've created an impression that COVID wasn't that bad in our country. And I think that has been the problem. But we've had a lot of, in terms of our models, we have some conspiracy people in our country that have tried to imply that the work that we're doing are exaggerated. And so our biggest problem is the people who are conspiracy theorists who believe that we're lying to our country about our data.
But there is a difference, isn't there, between an academic consensus on the one hand and a conspiracy theory on the other, which in a way Dr. Tegnell falls in that gap. The reason Dr. Tegnell, I assume, 10 Downing Street rang you directly and said, look, we want you to talk to the Prime Minister, we want him to speak to other voices, was precisely because they wanted to challenge the consensus.
Yeah, and I think that's a good part of the discussion we can have, and I think that's also been the good part of the discussion in Sweden. It's very dangerous to fall in consensus in this kind of situations, because I think, like Angela very well said, this is definitely a time you need to change, and we have changed over time, because there has been new data coming in, other type of issues, and also that the pandemic has changed its face during this time. So you need to be able to change, and I think that once again it's easier to change when you have the direct dialogue with the political level, because then you can more easily communicate the reasons why we need to change policies.
I think the underlying question, I guess, Angela, that I'm putting to you, Professor McLean, is that first of all, the data goes to SPI-M, then that data goes to SAGE, and then that conclusion then goes to two men who spend quite a lot of their time wondering what they can get past ministers. In other words, they take essentially political views about what they calculate ministers will and will not be prepared to do, say or see. Does that have a downside, both in speed, but in also directness of communication?
Well, I will stick up for them. I mean, I think without them here, it's a bit unfair to accuse them of being political. So can we just leave that to one side? I'll send that.
Let me be clear. I didn't mean as individuals. I meant built into the structure of this. Yeah. This was not a comment on Chris Whitty or Patrick Vallance. There's a need for them to calculate what they think politicians are likely to want to hear, because in the end they want to get things done, and they'd be daft to ignore that. Yeah, well, it wasn't a criticism of them.
I would say, I think I would agree that there is a cost to many layers. For sure, there's a cost to many layers. I think I do think the consensus is strong, and I agree with Anders that the consensus absolutely has to be prepared to defend itself. And I don't think we have ever said, oh, you can't argue with this because this is the SPI-M view. I think one of the ways this has got better in the UK is through more modelling inside government, so that there are more civil servants who sit and observe SPI-M meetings and can directly ingest the material, just so that there's more people advising ministers directly from inside the system. So I think that's helped. That sort of removes one layer. I think I would argue at the end of the day that the benefits of having that trusted voice, the trusted voices of Chris and Patrick, sat, week in, week out, next to the Prime Minister, are worth the costs. But I totally accept that there's a debate to be had there.
Interesting. Perhaps it would help people watching and listening if we went through a couple of examples where you've had controversial decisions in South Africa and Sweden, and how that interface between scientists and politicians work. Professor Gray, feel free to choose another, but the one of my limited knowledge of South Africa seems to me was the most tricky for you, was deciding that AstraZeneca wasn't going to do the job for you with the variant you had, and having at enormous speed to adopt a Johnson & Johnson trial, controversially. Talk us through that, if you would.
Yes, I think we were faced with a beta variant of concern, and data coming from our country showing that the AstraZeneca wasn't working, and having 1 million doses of the AstraZeneca arrive on our into our country, and having to tell the Minister of Health that night that we were in trouble, and then being able to very quickly in 14 days manage to get 500,000 doses and supply that to the healthcare workers. And we were 2 days short. We lost 2 days of the national rollout, but we never slept for 14 days, and we're able to give the healthcare workers vaccine. With the only time we managed to get a supply of vaccine to our country was in mid-May, and that was limited doses of Pfizer. And so if we hadn't started with the J&J vaccine, we wouldn't have been able to protect our healthcare workers before the next wave. And so I guess we were able to replace the AstraZeneca with the J&J. So
just so we're clear for this session, though, to what extent was that, as it were, your decision, or a committee of scientists, or the ministers? Talk about the interface between those, if you would.
I think it was a combination. So we told the minister that we had a problem. I had a solution, and we basically decided to go with the solution, and there were a couple of opinions around whether we should or shouldn't use the AstraZeneca, but I think at the end of the day, the decision to go with the J&J was confirmed by various other groups that agreed with that approach. And obviously, at that stage, it was a good decision, because we had a beta variant of concern, and we have evidence that the vaccine wasn't working. And so to go ahead and vaccinate our most precious healthcare workers with a vaccine that might not work would have caused more vaccine hesitancy and more and would not have been the right policy. And we were at the stage where you were basically, you're damned if you do and you're damned if you don't. And
I'm guessing from what you're saying that there was a lot of you in this policy. In other words, I'm interested, you see, in the structures here. Seems to me there's quite a lot of you in this policy decision. You had the authority with the minister to make that happen.
Well, we had information. We had data that our vaccine worked against the beta variant of concern, and we had data that the AstraZeneca didn't work. And so I was able to come up with a solution, and I was very fortunate that my minister, despite the big fights that we had in the past, that my minister trusted me enough to be able to execute the program. So despite the fact that we had fallen out over open toe shoes, he trusted me with the vaccine. Okay.
Dr. Tegnell, I guess the parallel with you was when, after the initial success of Sweden, people started to say, look, the infection rates and death rates are lower in the rest of Scandinavia. Other Swedish scientists started to weigh in and say, you should change your approach fundamentally. Again, in terms of what it teaches us about the way in which science and politics interact, what did you learn from that decision-making process?
Yeah, very much coming back to trust, I think, to be able to have a dialogue and, you say it in English, to make a problem of it, that these comparisons are never that easy. There were so many different factors coming into this, and our strategy from the very beginning, in very much agreement with the political level, was to have a sustainable strategy over time, and that even if you should change when you need to, you should not change without having really relevant data that shows that you really need to change. And I think we managed to convey that, not only to the political level, but not least to the population. Sure, we had a group of scientists that were very much in the media and opposed what we were doing, but in practice, the Swedish population was very much behind us. I would also say that the majority of academia was behind us. And I think that combination made it possible for the political level to have a little bit of ice in their stomachs, as we said in Sweden, and then sort of keep on the path that we fought for.
Professor McLean is smiling at that. Do you, listening to your colleagues from Sweden and South Africa, tell me if I'm wrong, it's your world, not mine. It sounds to me like they had a lot more personal power than any single individual in the scientific community in the UK, even than Patrick Vallance and Chris Whitty. Should we learn something from that?
Yeah, interesting. I mean, I was almost never in the room when they were, so I don't know actually what happened. I think the fact that they both talked about trust and trustworthiness is absolutely key to this conversation. And you know, we have this view in the UK that advisors advise and ministers decide, and I wouldn't throw that out. You know, at the end of the day, the ministers are the elected representatives, and these are very, very difficult decisions. I mean, especially early on when there was no good decisions.
I was struck by your introduction. You used that word servant. You emphasise the word servant in civil servant.
I do. I mean, maybe because I've been a civil servant for 2 years and I've been inculcated in the ways. But I go back to trustworthiness, and I will repeat it because I think it's worth repeating, that that's about being open, about showing you're working, about being clear about uncertainty, and it's being prepared to change your advice if the evidence changes. And I don't think structurally any of us would disagree about those. And I suspect, Nick, that actually I would suspect that the similarities are greater than the differences. Actually, when Glenda said my minister trusted me, that for me was really the important point. These are very important relationships of trust.
Glenda and Anders, you're both nodding, so a word on that, and then I'll move us on, if I may, to some of the areas where there was not consensus. I think masks might be the most interesting one to explore because it's been one of changing science, changing policy and differences between different countries. But first of all, Glenda, do you want to pick up on what Angela was just saying there?
Yeah, I think it's important. So even if you can have fallouts with your minister, you know, for people to pick up the relationship and be able to work together does say a lot, you know, for politicians as well, because they were willing to work. He was willing to work with me despite the fact that we'd had a major fallout. And so that's important. I think that trust and ability to change, as we've said, you know, to be open to change. And that's, I think that's sometimes the hardest for scientists, because sometimes we are a little bit, you know, this is our idea and we write. And so I think, like what Anders said, is to be able to recalibrate all the time takes it takes an amazing person to admit you're wrong.
Anders?
No, but I think we're all coming down to trust, and I think, as Angela says, I don't think the differences are maybe as big as we think. It's very much about trust, but then we need to remember that trust is not built during a pandemic. Trust is something you take with you into the pandemic, and I think we can all see very clearly in different countries in the EU, for example, that the amount of trust you took with you into the pandemic is very, very important to how well you can deal with it. It all comes down to that. So something you need to have in place long before.
Interesting. And as you're slightly disappearing into a haze, can you put your brightness on slightly more, because you're in a cloud slightly at the moment. Just a little reflection to you on trust. My first experience of this was as a political editor dealing with Tony Blair during the BSE crisis. And he called me and all the other political editors from TV into his office in Downing Street, pointed to a man at that time I'd never heard of before, Professor David King, who was then chief scientific advisor, and said, "This guy drew me a chart," he said, "of what would happen if I followed a particular policy, and it did it precisely. Anything he says, I'm going to do. You're in my office, but I'm not going to speak. Listen to him and go out and report it," which was one of those moments I really understood what trust means for a politician and a scientist in that way. He had absolute trust in David King, rightly or wrongly. That's what he had. So let's move on. Angela, if I could get you to start with these areas where there's less of a consensus, where there's a legitimate public debate. Masks, for example, but if you prefer another example, pick one of those. What do we get right? What do we get wrong in terms of, and if you can bring it back to the data analytics of what we knew. A little personal example, when I went to Vietnam, I referred those photographs, I wrote to my 4 consultants and said, shall I go? My call, but give me advice. And they all said, don't bother with masks, they're a waste of time. Here's the WHO advice.
So, yeah. Actually, I might leave the others to talk about masks, because I think the more interesting one is the role of children in transmission. So for a long time, a lot of people would say children play no role in transmission, particularly at a time when the only information we had was symptomatic people. So since children, largely speaking, much less often get symptoms, if you do an analysis based only on who's got symptoms, it doesn't look like children are transmitting. I think we now know that's not true. We know that from, in particular, from the ONS Community Infection Survey, where we can see the impact of children transmitting in their own households. So there, I think that was something where I would say that's one of the examples where I think there were people peddling their opinions as though they were facts without being clear enough about how poor the quality of the information was early on. You know, until we had a lot of testing, it was very hard to know what was the role of children, because they were so much less symptomatic than adults. I think that was I think that was unhelpful, and it's become clearer now, particularly now that children are the bulk of the unvaccinated population in this country.
Anders, and then Glenda, maybe you could talk about, you know, if you want masks, but in a sense, your positions were very contrasting. We just heard you, Glenda, describe that extremely severe lockdown that you had initially. To what extent did you feel able to be open with politicians and open with the wider public that candidly you didn't know? I mean, this was your best shot. Anders first.
Yeah, no, I think we were quite open about that, and but we also said that we need to take in very carefully, okay, what are the negative effects of doing something like that? And of course, we knew in the beginning probably a lot more about the negative effects about complete lockdowns than we knew about the positive effects. And I think with the initial learning we had done, that we were able to change the behavior of the Swedish population quite a lot through the trust we built and through voluntary measures. I mean, we could see that people in Sweden stopped moving around at least as much as they did in our neighboring countries. So we could see that 40% of the Swedish population started working from home and so on. I think that gave us the sort of argument for saying that going into complete lockdown will not change very much when it comes to the positive effects, but it will definitely add a lot of negative effects to whatever we're doing. So I think that sort of wide public health arguments were something our politicians listened very much to.
Glenda?
Yeah, I mean, I think it was interesting. We were one of the first countries, I think, to advocate masks in public. And this was based on an advisory from our MAC. And we looked at all the data at that stage, and that was in May, early, maybe late April. And we came along with the suggestion, which was taken up very. South Africa is a country of contrast, so we could implement a mask policy, but other things like alcohol prohibition is a different story. But I think it came coupled with the non-pharmaceutical interventions that were very were implemented all together. So it was the social distancing, the ventilation, the washing hands, and the masks. And that triad, or that NPR triad, was the tool that we used throughout the pandemic until we could get the vaccines, and we still use it at the moment. It's kind of ingrained in us. So good uptake on that. And the only people that oppose mask wearing are largely the anti-vaxxers. So they aligned to the right wing kind of thinking.
And yeah, Angela, to briefly get you to address masks. I mean, in England, and this is one respect in which we are federal in that sense, because there's a different attitude in Scotland, Wales and Northern Ireland. In England, mask wearing is pretty much dead, isn't it? Except in certain areas.
Not much mask wearing, I agree. Even in the tube, where it is obligatory, there's lots of people not wearing masks. My personal opinion is that's a mistake.
And was there a way, to get back to the data, of being open to the public that no one knew for certain the value of masks? Was there a way of having that communication, or do you have to hide your doubts in private, just sound more certain in public?
No, I remember actually saying at one of those Downing Street press conferences that there weak evidence of a small effect, which was the sage view at the time, and you would not believe the hate mail I got for standing up in public and saying that. I mean, that was probably my most horrible post Downing Street email inbox.
Because you were perceived as endangering people.
If only it had been that thoughtful. No, I was perceived as being stupid. That was, and worthy of other kinds of unpleasant treatment. Therefore, in my view, that's the evidence changed. We changed the policy. Well done, South Africa.
Let's talk a little bit about the cultural differences in adhering to measures, because Anders Tegnell, I know whenever you came on the Today programme, you made the point that in Sweden, and you've just made it now, you didn't necessarily need to have a law or regulation to require a high degree of cautious behaviour and social distancing. Is that something particularly Swedish?
I mean, that's probably better for others to answer that. But I think we have a tradition in Sweden that there is a high level of trust between the national level, agencies, government or whatever, and the public when it comes to public health measures. I usually bring up our childhood vaccination rates. We vaccinate more than 98% of all children born in Sweden on a completely voluntary program. And in spite of that, there is constant discussion in social media about the usefulness and the harms and so on. We still keep 98%. So I think very much building on that, but also on our legal tradition, I must say, because our Communicable Disease Act very much emphasizes the responsibility of the individual not to spread the disease. So that's how it's built up, and it also gives a lot of sort of power and things to people who are actually infected. They get free treatment and a lot of other benefits. So I would say it's not only the tradition, but also the legal system, the way we regulate very much of public health is in this tradition, and I think that's what we built on.
Professor Gray, in stark contrast from your presentation, it looked as if, particularly in that first lockdown, the law, regulation, enforcement were absolutely crucial. If you tried, as it were, the Swedish way, is there something culturally in South African society that would have made you think, forget it, it'll never work?
In the Disaster Management Act, it was very centralised power. It was a hard lockdown. And there was, as I said at the beginning, a lot of social cohesion around that initial decision. We were going to beat it. South Africa was going to go into lockdown and going to beat it. But what happened was that people lost their jobs, kids went hungry, and the country got devastated. School, we couldn't open up schools, and so the whole social cohesion. And the fact that we didn't beat it, and a lot of people had a lot of adverse effects from the hard lockdown, and so there was a lot of discussion about whether actually maybe we should have gone for a more risk-adjusted approach, which we have introduced at the moment. And that I don't think we'd ever go back into a hard lockdown, but we certainly, when we go through surges, we certainly clamp down on activities, mostly to try and keep the hospitals open, and that's around alcohol and curfews, to keep hospitals open for COVID, and try and restrict movement as much as possible. But obviously not as hopefully we've been managed to balance social support and preventing loss of lives.
And Professor McLean, there's been quite a debate, hasn't there, about the role of behavioural economics in persuading ministers not to lock down quickly, that the advice was it would wear off, people wouldn't carry on, they wouldn't comply at all, potentially. Is that one of the things we need to talk about behavioural economics? Somebody outside your door. Is that something we now to focus more on, that possibly the behavioural economics wasn't quite right?
I think the thing I would like to comment on is just despite the fact that it was a legal requirement, nevertheless, the astonishingly pro-social behaviour that we've had on repeated occasions, not just here, but in many places in the world. I think the fact that so many people have been prepared to adhere to lockdowns that were for the benefit of other people, frankly, take vaccines that are really, if you're a young adult, the main thing you do by getting yourself vaccinated is stop yourself from giving it to somebody else. I think all those highly pro-social behaviours have been fantastic, and actually I would say that really, really good science journalism has played a big role in that. So I think we've had a lot of, very clear explanation of what's going on, readily accessible to the population, and they have responded amazingly, actually. I mean, I would say the thing I would take away from this, which does go some way to answer you, is being hugely impressed at how pro-social the great majority of the population has been, and for how long.
And do either of you want to pick up, Anders or Glenda, on the issue of the role of journalists? That was largely the subject of the previous session, but you're going to have to forgive me. I'm going to say the role of the BBC should not be ignored during this pandemic. There are some people who'd like us to go for a more American style media, and I think you can draw your own conclusions about how successful that was during a pandemic. Anders, first of all?
I think the Swedish media has been quite mixed about this, both over time, but also that different media outlets have had sort of different agendas in this. I have quite a lot of contacts in other countries, and I think this time the Swedish media acted a little bit different than it usually does, with very much taking the role of investigating journalism and trying to find faults and so on, and relatively little, I would say, just transmitting messages from the agency and so on. So I think we were a bit surprised at the agency of the role that the media took this time.
Yeah, we had a very vocal media, so everything was debated in public. School opening, school closing, lockdown, everything. So I think most of the media houses carried the COVID debate 24/7, and scientists in South Africa were. You'd get 5 requests a day to be on television to discuss everything from the schools, the vaccination, how many vaccines, everything. So it was a highly politicized, highly debated, and lots of opinions from scientists, which was very good. And I think it was very vibrant. And I think that the scientists in South Africa asked very good questions and were very critical of certain policies that happened, and I think it was an important part of our vibrant democracy.
We've just got a few minutes to wind up, so I've got a couple of questions from the audience before I get you to draw some conclusions. First of all, we've got one from Stephen Evans, who says the issue of science advisor contacts with ministers is not new. I recall, says Stephen, a number of instances where members of the Committee on Safety of Medicines wished to have direct contact with ministers, but had to always have it filtered by civil servants. Are there times this should change? Don't feel you all have to answer, but if any one of you has probably Angela, most appropriately for you, do you think there are moments direct advice is preferable?
Very briefly, yes.
Can you be slightly less brief? What's
very briefly, it is important that the consensus gets challenged.
Okay. You're both nodding. I'm assuming you don't want to say more. That's absolutely fine. Then we've had an anonymous question which is interesting. Whilst I, says Anonymous, acknowledge the necessity of lockdown, I was wondering whether now looking back, would you change any of the measures of hard lockdown to mitigate the effects for children, struggling adults, etc.? So it's a sort of minute each, if you like, to reflect on what you might have done differently.
Yeah, I mean, I think the hard lockdown was terrible and devastating. Women lost their jobs more than men. Children went hungry, households went hungry, and we've never recovered. So I think the hard lockdown was not the right way to go. I think keeping schools closed, and sometimes, you know, maybe WHO didn't understand some of our context, but the advice that we were getting, you know, didn't help us keep our schools open. So I think the biggest mistake we made was to keep our schools closed, and I think hopefully we've learned from it, and it'll be a thing of the past, that our children don't go to school anymore.
Angela? Or is this one of those areas where you can be honest in private but not in public?
Yeah. I guess until this autumn, I would have said we should at least have tried hard lockdown but schools open. I think we know from what's happening now that wouldn't have worked. I mean, you know, the transmission we're seeing in schools now, when, okay, the rest of the country's open but largely vaccinated. I mean, I'm not aware of a really good trial that tried that. Maybe that's what we should have done. We maybe could at least have tried it. I mean, I think surely all of us regret most the damage that has been done to the youngest members of our communities because the schools were shut. However, it is not clear to me that was unnecessary.
And as in a sense, can't ask you this because you did resist lockdowns, but were there elements of the lockdown policies in other countries that in retrospect you wish you had adopted?
Let me start with saying that we are very happy that we kept our schools open. I'm sure it's going to, how much it's going to affect the spread of the pandemic in the society, that differs in different countries, and in Sweden that was not, especially not during the first year, not very apparent at all in the Swedish society that affected the pandemic. I wish in general that we had known much better what parts of society we needed to close down. I think that's one of the, when we talk about trials and so on, that's one of the things we could have as an international society done much better. To actually know, do we need to close down the gyms? Do we need to close down the restaurants? Do we need to close down schools? And in what context is that important? I think that's one of the things we could have done much better, because now many countries resorted, and also Sweden to a certain extent, resorted to very wide measures. We closed down all big events. Maybe that wasn't necessary. And I think that's something we really need to do much better in the next pandemic, early on, having this kind of science so we know what to close down.
So perhaps we could end this session with you know, around a minute each. Let's get right back to what we were asked to address in this session, which is this relationship between scientific advisors and government. You're writing a memo for your successor. Let's make it 20 years' time. So it's not to do with your personality. It's not to do with this crisis. It's not to do with that politician. If you had one or two things you could say to your successors, get this right and avoid that, what would they be? Professor McLean, first of all, sorry to put you first. It's the hardest question of all.
Get the data flows right. Think in advance for any emergency, what data you're going to need, and get it all lined up, everything agreed, so that you have the data, you know, from day minus 20, hopefully. So you really know what's going on. What not to do. Can I come back on that one? Because all the ones I can think of, I can't say.
We're amongst friends. Don't worry, there are no journalists here. Dr. Tegnell? You're on mute again, sorry.
Apart from what Angela says, which I agree with, I think the good advice is to establish trust. Establish communication, establish trust, so that you understand each other. I mean, not necessarily on the personal level, but on a agency, political level. I think that's important. And the second one, don't try to resolve your issues with a political level between you, so you don't have a dispute with a political level in public.
And finally, Professor Gray.
It's getting hard to answer those things because I agree with both, but data and trust is important. Data that you can trust and people that you can trust with the data, because often it's very scary for politicians, and sometimes the data, you should be able to have that conversation about the data.
Well, let me just end by not just thanking you for taking part in the session, Professor McLean, Dr. Tegnell and Professor Gray, but frankly, thank you for what you've been doing for the past 18 months or 2 years. There'll be lots of people on this call. I know, were we in a meeting rather than on a Teams call, would be giving you a big round of applause and a big thank you for everything you've done. And speaking from a journalist who day to day has tried to get a grip of this, it seems to me the crucial thing we need to do as journalists, and to a certain extent you can help us with this, is distinguish between what we know, what we think, and what is a legitimate public policy debate. And the schools opening is a classic example where science doesn't say yes, do it, or no, don't. It's a perfectly legitimate debate. And I think there's been a danger at times of a sort of lust for certainty, as if somehow if we dare to tell the public there's doubts on any of these things or there's debates, that they'll run for the hills because they want to simply be told what to do. I think hopefully what we've all learned from this session and also from our experiences over the past 2 years is the public are brighter than you often think they are. So thank you very much indeed. Thank you for everybody taking part. There's a break now, I'm told. I think my message telling me quite how long that break is for has gone off screen, I'm afraid, but there is a break now, and a message will come up, no doubt, to tell you. Thank you again to the participants, and thank you for joining me.